Hey, welcome to the Go-To Physio Sports Massage series. In today's lesson, we're going to talk about the glutes and the hip joint soft tissue mobilization techniques that I've used both in pro sport and in private practice. As always, when we use our soft tissue techniques, please respect the 80-20 rule. 20% of our time is spent on the symptoms, okay? 80% of our time is spent on asking ourselves why these tissues are in this state, so to speak, or reacting like this in the first place. And that's where we have to find the true cause of the problem. If you want to help with that, head over to thegotophysio.com. I've got loads of tips and help for you there. Okay, so without further ado, here's my favorite techniques to mobilize the glutes and various other deep rotators of the hip using sports massage techniques. Okay, so for the gluteals and the hip rotators, what I like to do is I like to actually come over the person. Okay, so again, I find this way I can get a lot better pressure and it keeps my body safe. So all I'm going to do is I'm just going to come across Pete here. Now I'm going to put this hand to stabilize, and then this elbow is going to do pretty much the whole work. So you can see here just from my elbow, I've got complete control of what's happening at Pete's body, okay? So I can push this superficial glute max over a little bit, and then I can actually sink into his glute medius if I want to here, if I want to get some pressure through there, okay? And then if I'm going to go lower, I might use this hand. So again, just getting good feel through that elbow and forearm, I can control Pete's body quite quickly here, okay? So I've got nice control of that. So again, what I would do is I would just sink in. Now this bed's probably a touch high for me, so you do need the bed to be quite low for this because you want all your body weight going through the forearm. So my stance is quite wide, and then all I'm going to do is I'm just going to sink through that tissue, and then I'm just going to put a force through it. So again, I'm just running my hand from that greater trochanter towards the sacrum, okay, to get all those deep rotators. Again, you know, we will be influencing them some little bit here. We'll have a lot of glute max here obviously as well, because we're going through that. We'll have a lot of skin, we'll have probably a lot of adipose tissue, etc. Okay, and then the higher I go with glute med, I can do that, and I usually like to do that inside line, okay? But this is a decent one just for a general, if you want to stimulate these tissues, if you want to bring some kind of modulation about, just getting the glute here, you know, if you're doing some kind of trigger point or whatever you want to call it, in order just to stimulate that tissue and bring about some kind of modulation, it's not a bad one. So Pete, if you lie on your side facing me, okay, actually if you face the camera, sorry. Okay, and then what I can do here as well then is I can expose his hip a little bit. So in this position here, Pete, just let that knee drop. So now here I've got good exposure to glute medius, okay? So again, I can massage through that. I've opened that up a little bit so I can sink in past the greater trochanter, and I can just go up towards that iliac crest very, very easily here, okay? So again, whether you choose to take off the person in shorts, you know, that'd be your decision. If they're wearing appropriate underwear, absolutely fine as well. And then as I go here, so obviously I went forward to about 10 o'clock there for glute medius, up to 12. Then if I go towards kind of 9 o'clock, and I just come through here, that's going to be more piriformis, okay? And then obviously as I go down, I'm going to be getting all the other deep rotators as well. So this just opens up the hip nicely, sinking by the greater trochanter, and then you're just going to come down through it there and get that nice kind of modulation there, okay? The one thing I would encourage you in this position is don't just treat every single tissue for the sake of it, but identify what tissues, you know, what plane of motion are potentially contributing to this pain experience, and go about bringing a positive influence as opposed to, you know, just sticking your elbow in everywhere and hoping for the best. So have a bit of purpose, a bit of intent with what you're doing here in order to bring about a true meaningful change to that person's tissue tone, which would then hopefully result in a correspondence with an improved range of movement, some kind of improved confidence, some improved motor output, or whatever you're using, okay? So don't just treat them for the sake of it on the bed, but understand why you're influencing this particular tissue in this particular direction. And from there, then we can start to recheck our work very, very quickly.